invitation to the 8th Zeluma International Scientific Research Congress from Gaziantep. My name is Gheorghe Giurgiu and I am from Romania, a scientific pioneer with the innovation in several fields: mechanics, electronics, weapons, medicine. And together with Dr. Manole Cojocaru, we present the paper Deniplant Nutraceuticals may help for endometriosis pain.
Good day. I am Manole Cojocaru, Professor of Physiology and Immunology at Titu Maiorescu University, Faculty of Medicine of Bucharest, Romania, Senior Scientific Researcher Degree 1, European Specialist Laboratory Medicine, Senior Specialist Allergology and Clinical Immunology. I am honored to present you the team Deniplant Nutraceuticals may help for endometriosis pain. Endometriosis is a chronic and debilitating condition affecting 10% of women. As an estrogen-dependent disorder, endometriosis predominantly affects women of reproductive years, age 15 to 50. Endometriosis is characterized by infertility and chronic pelvic pain. Dysregulation in this innate immune response in response to ectopic endometrial tissue has been implicated in endometriosis pathophysiology. The need for a successful integrative approach towards treating endometriosis is growing. Inflammation has a main role in the progression of endometriosis. The mechanisms by which endometriosis induces a chronic pain state remain poorly understood. A growing body of research is indicating that inflammation plays a key role in both the severity of endometriosis symptoms and progression of the disease. Some findings have highlighted in the main role of inflammation in endometriosis by acting on proliferation, apoptosis, and angiogenesis. Nutraceuticals may range from isolated nutrients, herbal products, dietary supplements, and diets to genetically engineered designs, foods, and processed products such as cereals, soups, and beverage, and hence also referred to as functional foods. Nutraceuticals is demonstrated to have psychological benefit or provide protection against chronic disease. Nutraceutical is composed of two words, nutrient and pharmaceutical. Nutraceutical is a marketing term developed for nutritional supplement. Nutraceuticals are the pharmaceutically blended products that possess both nutritional as well as the medicinal value. Hippocrates once said, "Let food be the medicine and medicine be the food." The introduction of new agents can be effective in improving the condition of patients. For example, plants are promising sources of bioactive natural components. These natural components could be interesting strategy in therapy. While there is no absolute cure for this condition, some home remedies can relieve pain and discomfort it brings. The purpose of this presentation is to summarize the potential action of Deniplant nutraceuticals in endometriosis by acting on inflammation. The primary symptoms of endometriosis are pelvic pain and infertility. Pain nutrients are known to help reduce systemic inflammation, and in this presentation I will discuss how Immunoplant T can be used to reduce inflammation and the severity of endometriosis symptoms. This clinical study evaluated Immunoplant T, resulting in an acceptable outcome in endometriosis patients. Immunoplant may play a significant role in treating symptoms of endometriosis patients. Chronic pelvic pain and dysmenorrhea were less after 3 months. Immunoplant T is a natural immunomodulator of the human microbiome, removing dysbiosis from the microbiota can prevent and eliminate endometriosis pain, regulate cellular metabolism, regulate the central nervous system, modulates the activity of important neurotransmitters, physically and mentally energizing, remineralizing, increases fatigue resistance. You can see Immunoplant indicated in autoimmune disease, metabolic disorders, disease of the internal organs, liver, kidneys, lungs, hyperacidity, metabolic acids, metabolic syndrome. Duration of treatment is in relation to the evolution of the disease, 2 or 6 months. It can be used in parallel with allopathic medication prescribed by your doctor. In conclusion, endometriosis is currently considered an inflammatory disease. Herein, we presented a systemic review of clinical data on the use of Deniplant nutraceuticals in the treatment of endometriosis. The use of Deniplant nutraceuticals could be interesting in disease management for women. Deniplant nutraceuticals can down-regulate inflammation in endometriosis. Nevertheless, the limited number of studies focusing on the different interactions of Deniplant nutraceuticals in endometriosis restricts its clear and immediate use in a therapeutic strategy. Thank you for kindly invitation. Thank you very much for your attention.